thinking about, the role you play as a corporate leader in this community, to the extent that you've been able to think about this, what economic trends are you watching? And how would you like to see regional leaders come together and think about a framework for economic recovery, which is something through Greater MSP we've talked about doing now, because we are headed more deeply into this crisis. But in the weeks ahead, we will have the opportunity to start making recovery choices. And it would appear that Minnesota has done as well as any state in the country in this early phase in the crisis. And we may have the first shot at planning recovery.
Well, I mean, first and foremost, what I would say, that before I talk about economic recovery, I kind of want to talk about pride. I think you just touched on it a bit in your question. I'm really proud of how our communities rallied during this crisis. It's one of the most attractive things to me in coming to Minnesota was just the clear experience that we rally in trying times. And I think when we look back at this crisis, I would predict that Minnesota will stand out as a community that managed this better than most. I believe we still have the lowest prevalence per capita in the country of all 50 states. So we're clearly doing a very good job of keeping people healthy. When we look at the hospitalization rate versus hospital capacity, we're doing really well in that regard. But I also hope and think that economically that we will do this well, to your point about striking the right frame, developing the right framework to return. I think in terms of the trends that we're watching, I heard just this morning that about 82% of all Minnesotans are still working. And so I worry about the 18%. And I think that's kind of the issue, the impact of both the 18% that are not working, as well as the impact on small business that we're all hunkering down, which I think is good to be safe, but we need to jumpstart the community. And so I think we're looking at sort of the support and utilization of the economy in support of small businesses in particular, and getting the 18% back to work. I also specifically look at metrics related to inequities. I very much worry about those. We're doing better than other states in terms of illness prevalence and certainly death rates in diverse populations in the community, but I very much worry about that, and that economic recovery isn't in many markets evenly distributed, and we need to make sure that it's so. When I think about framework, we're already beginning to think about framework. We're an early leader in getting people home. I think we want to be an early leader in getting people back. And so the sorts of things that we're thinking about is, how do we think from a timing perspective of bringing people back to work? So for us, what we're thinking is something like this. Commissioner Malcolm talks about the fact that we can begin to think about lifting sort of social distancing restrictions after a 14 consecutive day decline in new cases. So our current plan is to say, okay, let's experience that 14-day decline, and then let's wait another 14 days. And we will begin to bring people back after that 14 days, after the 14-day decline. We believe, we're functioning quite well virtually as an organization. We want to keep our people safe. We want to bring people back. So that's, we have to think about a time frame methodology. The second thing is it's not an all or nothing. We want to think about sequencing. Who can we bring back first? And from our point of view, it's who's the lowest risk? Who doesn't have elderly parents? Who doesn't have, who are those individuals that can both safely be socially distanced when they come back to work? They want to come back to work because of well-being issues at home, and they're socially isolated and they're social beings. Whatever the case may be, how do we think about how to sequence our associates so we bring back the right folks first?
That sounds like a very personalized approach to doing that, rather than thinking about a department or occupation.
Yeah, we're bridging all boundaries through Zoom meetings like this. It's just been remarkable. I just, as a joke, I think we've gotten closer through Zoom. I joked with my team when I ask difficult questions, I remind them that I can see all of their faces simultaneously, which I can't do when I'm sitting around a conference table. So we've done really well virtually. So we don't have to do this from a departmental standpoint. There are other ways to connect departmentally. I think we're thinking of balancing economy and safety. And then the last thing that we're thinking about is, well, what would we require for the people that come back? Would we want to do temperature assessments? Would we want to have our associates wear masks? We have to remember that masks are not to protect yourself, it's to protect others. But what if we essentially said, we're going to get you really hip and cool masks to wear that are Blue Cross branded, maybe. But we really would like you to wear them because that's how we can bring people back. And then most certainly social distancing. So that's how we're thinking of a framework of keeping people healthy, but really driving to economic recovery.
That's really thorough. And I think that would be very helpful because, Blue Cross Blue Shield is going to be a leader, I think, in that respect, and others will be very interested to hear what you're doing. You had mentioned wellness, and we'll just end here in our conversation today, but wellness for your team over the next number of weeks, 14 plus 14, plus whatever it takes to get us there, still quite a few days. And so what have you and your team been able to do maybe to monitor and support the wellness and well-being of your team and your staff while they're teleworking?
Yeah, it was interesting because I think at the beginning when we all worked from home, people were certainly thankful. They felt that they were safe. And in many respects, I think people were really happy to be at home, roll out of bed, work unshaven and in sweats, and have for me, having my dogs at my feet. And then all of a sudden we realized, well, this isn't all that it was cut out to be. I think there are emotional peaks and valleys. If we're social, it's really hard. This isn't quite the connectivity we want. I don't know about you, Peter, but the danger for me is I can roll out of bed, be at my desk at 5 a.m, and I'm still here until midnight and eating at my desk, and it's not healthy. It's physically and it's emotionally draining. So we've been doing anything and everything to really keep our associates happy. We've mixed it up. So we've sent out a bunch of videos. We just sent out an ELT video sort of with our kids and with our pets. And, we've worked to be very visible and to be very real and very authentic. We haven't really sugarcoated anything. We've found ways to connect in numerous ways. And we actually have shared, they say that in times of crisis that the whole executive team needs to be CCOs, chief communications officers. That, I'd say 60 to 70% of my time right now is communicating. And I think that's what we've been doing. We also just surveyed our associates, and I'd encourage, other employers to do the same. Ask. We did a survey to ask our associates what they need. And what was remarkable is the needs aren't big. What they're asking for is either more communication, or they're small, or they're generally inexpensive. And a small amount of resources has gone a long way to make people more comfortable and feel more connected at home. So we're, our priority is keeping our people safe. And as I said earlier, it's not just physical, it's social, it's job preservation, and it's behavioral and it's psychological. We want to be there in every way for our associates during this crisis because it's totally unprecedented and it's not what people thought.
Right. And are you seeing, well, that all makes sense, and it's creative, and as you said, it's real, and this is very real time for whatever else it is. Have you seen the productivity of your overall team be maintained throughout this period?
We really have. By every measure, we're a service first company, and I think in many respects, we've seen our service performance improve even further. And I think the greatest fear, especially with teleworking, is that we see productivity drops. We have not seen that at all. We've seen our people get closer to each other. We've seen our culture get stronger. We've seen the productivity rise. Now it's a different time. The demands for our people have shifted from before the crisis, but all looks as strong, if not stronger, than it was before. And it obviously begs the question about how our world may need to change from a business perspective after the fact. You know, we're having associates saying, well, I've enjoyed working from home. I don't have the social isolation issues. Can't I keep working from home? And I think our answer is going to be probably yes. You know, it makes us really think about, if we're equally productive and many people are happier and potentially it's less expensive, do we need the physical plant that we've got if we're experiencing the same level of productivity?
There are only big questions. So, so in our conversation today, Doug, how do you manage a major operation? What real estate's required? The future of the American healthcare system in a short 20 minutes. Thank you for taking time out to have this conversation.
It's my pleasure, Peter.
And thanks for everything you're doing within your company and for our health system to keep it strong and in our community.
Same to you, Peter. Be well.
Okay. Talk soon.
Take care. Bye.